The administrative overhead of private insurance companies averages around 20%, while that of traditional Medicare is 2 to 3%. Medicare now is a tried and true single payer, a single insurer. If we made Medicare, with its low overhead, the single insurer for everyone, that administrative $1 trillion that we now spend could shrink to about half of that. We could instantly save around $500 billion each year. That money is more than enough to provide full insurance coverage for all Americans with no deductibles or copays. It's more than enough to provide for dental, vision, and hearing care, all of which contribute to better overall health. It's more than enough to pay for all prescription drugs. Back in 2003, when Congress passed Medicare Part D, the prescription drug plan, Medicare was forbidden to negotiate drug prices. And with hundreds of private insurance companies, none of them controls enough of the market to negotiate individually with the drug companies. That's why we pay the world's highest prices for prescription drugs. But if we had one single insurer to pay for all the drug costs for the country, that single insurer would definitely be able to negotiate better prices, as occurs in every other developed country. We could save probably 40% on our drug costs. That, along with negotiated prices on medical devices like implants and heart valves and hip replacements, could save another $150 billion. We would pay closer to what every other country pays for these things. Americans could stop getting their prescriptions filled in Canada and Mexico and bring that business back to America. That's an estimated total savings of as much as $650 billion each year by moving to a single payer, a single insurer system. Some studies show less than that, but no study shows that a single payer system would cost more than what we would save. Financially, this is a foolproof solution. Reduce wasteful administrative overhead, negotiate drug and device prices. Just good, standard business practices. Why haven't we been doing this all along? It's because a free market system simply hasn't worked for healthcare. It's been trying for 50 years and it has failed. The bottom line is that every other developed country has faced rising healthcare costs and has done something rational about it. They haven't all done it the same way, and some work better than others. But there are enough examples that we can select different aspects of their experiences to design our own single-payer, single-insurer system that best fits the United States. We believe that's improved Medicare for all, with everybody in, nobody out.